Hey, I'm Jenna Wolf, certified lactation counselor, parent coach, and extended breastfeeding mom of two. I fully understand the unique challenges of breastfeeding beyond the baby days, and I'm here to take your hand and support you along your journey. So toss that hair in a messy bun, grab a basket of laundry to fold, and let's get started. This is Start to Stop Toddler Breastfeeding.
Breastfeeding your sick toddler. So this is obviously a topic that has been near and dear to my heart, as anyone who has been following this podcast knows that we've been having a lot of sickness in our house. And if you follow me on Instagram and you're listening to this podcast the week it's out, you'll know that we just had a stomach bug go through our house as well. And when I shared on my Instagram stories that we were kind of all knocked out with a stomach bug, I had a lot of you reply to that story and say that you were going through some sicknesses too. And I felt like it was a really great time to share with you some support to breastfeed your toddler while they're sick. So, like practical support, but also some of the science behind breastfeeding your sick toddler. So, before I get into things, I just want to say that this is not medical advice. And anything I say in this podcast is only for educational purposes. And of course, that goes for any content that you get from me on this podcast, in my emails, or on my social media accounts. So now that we have that out of the way, I want to share one other thing. In this podcast, I'm going to be talking about short-term illnesses, generally, viral infections, perhaps bacterial infections. But if you are breastfeeding a toddler with a chronic condition or a more serious illness or hospitalization, a lot of this is still going to apply to you. There are only a very, very, very small number of instances where breastfeeding is truly contraindicated for a sick child. So when a child has a certain type of sickness where breastfeeding cannot occur with that sickness. Honestly, it's incredibly rare for that to be the case. That being said, there are some instances where that is the case. So if you've been told by a medical professional that you need to wean your sick child, or that breastfeeding, you kind of left a conversation with a medical professional feeling like breastfeeding was really unnecessary, or perhaps just too difficult while your child's sick, and you would like to continue breastfeeding. So if you've heard that from a medical professional, but you'd like to continue breastfeeding, I just want to remind you that you have every right to ask to speak to either an IBCLC that the hospital could provide, or call an IBCLC yourself. So an IBCLC is an international board certified lactation consultant. And that's really the gold standard. There are, lactation counselors like myself and other people who can absolutely provide you with information. But if you're in that instance where you're talking with a medical professional, you may want to ask if the hospital has an IBCLC that you can speak with. And then you just add a lactation specialist into your child's care team. Because a lot of times the medical professionals are simply just not educated on that particular, area, breastfeeding, right? And they're going to err on that side of caution, or they just don't understand the benefits and why it's important to you to breastfeed. And so adding in somebody into your care team can just protect that and in many ways support you and your child on their road to recovery, right? And through your relationship. So this is not medical advice. I'll be talking about short-term illnesses, but this still applies to chronic illnesses and hospitalizations and more serious illnesses. And so I hope that if you are in that position, or you ever are in that position, first of all of my thoughts and prayers to you, Mama. That's very hard. And I also hope that you can get some good insight and support out of this. So let's dig right into it. There's going to be kind of three big areas that I'm going to talk about, which is why should you continue to breastfeed your sick child? I'm going to move into some practical support. And then I'm also going to talk about what to do when your child is now well again and moving through that. Okay, we've been breastfeeding maybe more frequently, and now we've got to scale back. What does that look like? So I'm going to talk about why you might want to breastfeed your sick child, some practical support to breastfeed your sick child, and then what to do when your child is better. So let's get started. The very first kind of obvious reason that you would want to breastfeed your sick toddler would be hydration, right? It's what we think of, right? Breast milk, it's a fluid, it's a drink. So breast milk is actually a clear liquid. I'm using quotations with my fingers right now as I say that. So a clear liquid means that you can safely give your child breast milk before any surgeries where the restriction is clear liquids only. And it also counts as clear liquids when your doctor might suggest giving your child clear liquids when they have, or electrolyte drinks or those kinds of things when they have a stomach bug or something that could cause dehydration. So if your doctor, or if you normally, generally speaking, your child has an ailment where hydration would be a concern, then breast milk is absolutely your best bet at offering your child hydration. They do not need water or an electrolyte beverage if they have like full and continued access to breast milk all the time. Now, if you're breastfeeding like an older toddler, maybe like a 3 or 4 or 5-year-old, and they eat a lot of other foods and you're not breastfeeding super frequently anymore, then consider breast milk like a beautiful addition to water and electrolyte beverages. But you can continue to give them breast milk and it will continue to count as an electrolyte beverage for however much breast milk they are getting. So hydration, wonderful, but there is so much more that breast milk offers your child when they're sick. It actually takes around 6 years for your child's immune system to mature. So some studies I see say between 2 to 7 years in there, but normally your child's immune system is still maturing up until that 6-year mark. So nature has provided really beautiful, easy access immune support for your child to fill in the gaps for their maturing immune system through your breast milk. And one of the really cool components of breast milk is lysozyme, which is an antibacterial, antiviral, anti-inflammatory, antifungal enzyme that actually increases in concentration after 6 months of breastfeeding, and then again at 12 months. And then some studies show that it even increases again at 2 years. So that concentration is just increasing of this really superpower enzyme that is inside your breast milk. It's almost as if nature knows that your toddler is going to be in instances where they're probably going to need that extra immune boost, right? They're going to be putting things in their mouths. They're going to be interacting with other kids and in situations where they're likely to be encountering pathogens, right? And so, yeah, it's a beautiful component of breast milk that is continuing to increase over time. So it's even more protective at 2 years than it was at when they were a newborn. Your body is also producing tailored antibodies to support your child. Even before, whatever's in the environment around you and your child, your body is adapting the breast milk that they're getting to support them in kind of fending off whatever pathogens are in your environment. That drive that you have to kiss your little sweet kiddo on the cheeks, right? That is actually picking up pathogens off of their skin. So if they've been apart from you, that's one of the ways that your body is picking up that little bits of information and knowing how to tailor that milk to meet their needs. And your body was doing this before your child was even showing symptoms. So pretty cool, right? Another thing that breast milk does can help restore a healthy gut microbiome during an infection, as well as after even antibiotics. So oligosaccharides are present in breast milk. So they are a type of sugar that your child's body doesn't actually break down. So it kind of passes through their body. But what it's feeding is healthy bacteria in your child's gut. So your child also has lactoferrin, or your breast milk, also has lactoferrin and all these different things in it itself. But it also has things that are just in it to feed the healthy bacteria in your child's gut to help that flourish and grow. Again, that's really important for future immune support as well as present immune support. As well, concentrations of fat and protein actually increase in breast milk as your baby moves into toddler years. So we know that they're starting to increase around 12 months and continue to increase. We know that even in the second year of life, your breast milk will meet about 43% of your child's protein requirements. Okay, so if they're not eating anything else, your child's still getting fat and protein and carbs and all of those things simply through your breast milk. And in that second year of life, about 60% of your child's vitamin C requirements will be met through breast milk, and 95% of their vitamin B12 requirements, and so many more. Your breast milk is teeming with those macronutrients as well as those micronutrients, right? We're talking, yeah, all of the minerals and vitamins that your child needs to stay healthy, right? To fight off this virus or bacteria as well as stay healthy. And lastly, well, not really lastly, there's so much more I could go into, but last for what I'll share right now is hormonal support. So your breast milk has oxytocin in it, which is the love hormone, the bonding hormone. So not only do they get oxytocin from just snuggling with you, but they're going to get that added boost from your breast milk itself. And that oxytocin can provide really pain relieving comfort, right? And another hormone that's in your breast milk is melatonin, which is the sleepy hormone. It's going to support your child to sleep more peacefully, even when they're feeling ill, and for you to be able to get a little bit more sleep at night. And that melatonin does increase in the evenings, right? So it will support your child to be restful when you want to be restful, right? If that makes sense. Okay, so that is just some of the amazing reasons why you might want to consider breastfeeding your sick toddler. So let's talk about how you can breastfeed your sick toddler. So when your toddler is sick, if they have something that is causing pain in their throat or in their ears or their mouth, it might be difficult for them to breastfeed. It's probably going to be difficult for them to eat anything or drink anything, which may also include breastfeeding, right? So you may find that a little bit of over-the-counter pain relief can be supportive. This is particularly important to consider if dehydration is an issue. Like if your child is really struggling to get things down, you might want to consider some over-the-counter pain relief like ibuprofen, acetaminophen. You can even look at things like arnica. That might be something you want to talk to your doctor or your pharmacist about. But that's really important. Another thing is if your child's struggling to breathe when they are breastfeeding, like because of congestion, you might want to use some steam. You could also use a saline mist in your child's nostrils. Another one that is really good is it's called Clear. It's like Clear nasal spray with an X, and it's got xylitol in it. And the xylitol actually helps to remove bacteria and allergens and things from your child's sinuses as well. So it's like saline with xylitol added into it. So that's something that you could look at if they've got that nasal congestion. A lot of times they'll still continue to breastfeed through the nasal congestion. They'll just be kind of popping on and off a lot, which if you have some nursing aversion, it can be quite irritating. So you might want to try breastfeeding in the bathroom with like a hot shower running or a humidifier running or something like that, just to allow your child to breathe. And so they can have kind of a longer space of breastfeeding for a little bit to get what they need without kind of that popping on and off constantly. That can be a little irritating if you're already struggling with some nursing aversion. So it's also important to remember when it comes to practical support that by the time your child has displayed symptoms of a viral infection, for example, it's very likely that you've already been exposed to it yourself. So what can happen is that moms start to say, oh my goodness, I don't want to catch this. So I need to stop breastfeeding. But the reality is your child has likely already been contagious for a few days beforehand. Now, depending on what particular ailment that your child is diagnosed with, you can check the CDC website or whatever to see what they suggest is often the period that they're contagious. But generally speaking, they're contagious before they even exhibit symptoms in most cases for things like hand, foot, and mouth, that kind of stuff, for respiratory infections, common cold, all of that. So that means that any efforts you make to not get sick, don't make them too stressful on yourself, because the likelihood is you've already been exposed to it. So don't worry too much about things like pumping to give your child milk in a cup in order to create that separation. First of all, you're losing some of that snuggles and comfort that your child wants so desperately. And it's likely not even going to be very effective in stopping you from contracting whatever your child has in and of itself. Now, a lot of times it is worthwhile to consider that a lot of childhood illnesses are more difficult for adults to catch, or adults get them slightly less symptomatic. Like their symptoms aren't as intense. Again, it depends on the particular virus that we're talking about. But, it's very possible that even with being in close contact with your child, you won't contract it, right? That's an absolute possibility. Now, if you're anything like me, you're probably going to contract it because it seems like I do all the time. But that's just me. So, anyways, don't worry about pumping and giving your child milk in a cup because you're probably already exposed to it. Another thing is, a lot of times moms will want to wash their breasts or wash their nipples after a feed. But in nearly all cases, this is not needed. In fact, can actually cause more harm because you have these little glands around your areola called Montgomery glands or Montgomery tubercles that secrete oils that are antimicrobial. So the oils themselves are moisturizing, they create some lubrication, they help keep the tissue healthy, and they're also fighting pathogens on the skin to help keep everything healthy and clean. So you don't need to wash it. And in fact, when you wash it, you're washing away those oils and can leave your skin dry, which dry, cracked skin is more likely to be infected, right? That's where pathogens can actually enter into your bloodstream and into your body. So ixnay on the pumping and feeding in a cup, you don't have to worry about washing your breasts. And if you're tandem feeding, so if you have a toddler and a newborn, you also don't need to worry about washing your breasts in between giving like milk to one child and the other. Again, they've probably already been exposed to it. If they're around each other at all, it's very likely that that's happened. You've already been producing antibodies to this infection before your child was even exhibiting symptoms. And also, your body's already protecting your breasts themselves from, having that infection kind of live on the skin, right? With that oil. That being said, of course, there are probably instances where that might be necessary to wash your breasts. Of course, talk with your doctor, talk with a pharmacist if they're perhaps getting some kind of medication where it might, or maybe they have creams on their face or different things where you wouldn't want that on your skin or to be touching a baby. Those are all instances that are kind of unique situations you'd want to talk to your doctor about. But again, in general, you don't need to worry about that. You also don't need to worry about using like a nipple shield in order to stop contact or anything like that. Those are things I see people talking about or asking about, and you don't need to worry about those things to inhibit the transfer of germs. Now, let's talk about taking care of yourself. So, your breast milk, if you listened to my episode on, upping and decreasing your milk supply when you're extended breastfeeding, you'll know that illness alone isn't likely to cause your supply to dip, but not eating or drinking enough can absolutely cause your supply to dip. So you need to take care of yourself, mama, through this time. Prioritize listening to your body, which I know can be really, really hard. And I talk about that in my free workshop. So if you are interested at all in this kind of piece, make sure that you have gone to www.ownyourparentingstory.com/workshop and had to listen to my free workshop. But it's really important to tune into your own needs and to listen to your hunger and fullness cues and to drink when you are thirsty, as soon as you're thirsty, and drink until you're not thirsty anymore. You do not need to force a whole bunch of extra fluids on yourself above and beyond what you're thirsty for. Just meet your needs. Take care of yourself through this process. As well, you don't need to worry about galactagogues, which are things that are herbal supplements or whatever to increase your supply. In a lot of cases, those things are actually not evidence-based at all. We don't have any science to suggest that they actually do anything to increase your supply. Sometimes there's just a lack of evidence, like we just don't have a lot of research on it. But in this case, we're talking about a short-term illness. So taking extra things right now, you just don't worry about it. Don't stress about it. They're not likely to really be very helpful. And it's just not something you need to worry about. So don't worry about doing anything special to increase your supply during this time. Now, I want to put a little caveat here. If your little one has a stomach bug, so if you guys are going through a stomach bug, this is my real mom life in the trenches tips and tricks. This is my hack for you. After, 6 years of parenting and having had many a vomiting child in my bed with me, this is my advice. Get some disposable bedwetting like pads. So there's like disposable bedwetting pads for toddlers. Don't use the pet ones because they're not meant for children. And so it's possible that there's like chemicals and different things in there that just aren't meant for children. Get the ones that are meant for kids and line your bed with those. Line their bed with those, okay? They're very easy to change in the middle of the night. You just pull it off and lay a new one down. Normally there's little sticky pads on the bottom, so you can kind of put those in the spots that you need. And it's going to make things a lot easier. And then my other suggestion is to get some small kitchen garbage bags, like plastic kitchen garbage bags, and some disposable diapers. Toss the disposable diaper in the garbage bag and then stick that garbage bag over a bowl for any vomiting. It's going to absorb the liquid. You can tie a knot and throw it away. You can also align potties for more loose stools. It will absorb the liquid and you can toss it away. You don't have to be touching anything. You don't have to be disinfecting anything. It's just really quick and easy. Side note, you can then take those lined bags or keep the bags and some disposable diapers around to line a potty for when you're in the car, when you're traveling. That way you don't have to be worrying about like rinsing out pee in a potty or anything like that. It helps so much, especially if you get sick too. It just keeps everything really easy. You're not worrying about having to clean up messes. Okay, that is my, tried and true mama advice to you. So we've gone over why you might want to breastfeed, and we talked about the immunological factor, the macronutrients, the micronutrients, the hormonal support, all of those things that your breast milk is full of that's going to support your child to feel better sooner, as well as just feel better throughout the process, right? Then we talked about practical support. So helping your child to breastfeed even when they're sick, as well as keeping yourself well and sane during the sickness and during the process. So now we're going to talk about kind of the recovering from the illness and how you can kind of transition in your breastfeeding from where you are when you're not sick to being sick and then back to not being sick anymore. So one of the things that you can be worried about or thinking about is supply and demand, right? Your milk supply during this process. So if you already are breastfeeding your child freely throughout the day and night and your child gets sick, just continue to do so. Your supply is going to just naturally match your child's demand. And it's going in both increasing and decreasing. And you won't have to pay any conscious attention to it or do anything else. It's just going to take care of itself. So this is often the case with, 1-year-olds or 2-year-olds. They're breastfeeding a ton anyway, and it's just normal. That's great. Keep at it. Do what you're doing. Don't worry about it. Now, even if you have a child that age or a little bit older, but you've created some routine and structure, or just naturally you have some rhythm and routine and structure around your breastfeeding, so either intentionally or just naturally, it's your choice whether or not you want to breastfeed outside of that normal routine. So all of the beautiful things about breast milk are still going to be there and still be relevant, even if your child's only getting a teeny tiny bit of that breast milk or breastfeeding very infrequently. In fact, like I was talking about with some of those immunological factors and whatnot, the concentration of those things not only increases over time, but increases as you wean. So the less milk you're producing, the higher the concentration is for some of those immunological factors, which means, hey, even if your child's getting a tablespoon of that breast milk in a day, that is a big boost to their immune system, an important boost to their immune system. So it's still valid. It's still worthwhile. That being said, if you would like to allow your child to breastfeed more during the time that they're sick, you are more than welcome to do so. Your breasts will never actually empty. So it might feel like there's nothing left in there, but your breasts are always producing milk. It's not like a factory where they like hit their quota and they're like, we're done for the day. The breast milk is always being produced, and it's just being produced on different kind of timelines or different rates. So it's always going to be being produced. And while the demand is increasing, so when your child is breastfeeding more and more at the breast, suckling more and more, they will be getting milk. But as that demand increases, the production rate is going to increase. So they're going to be producing more. Not necessarily, again, not like a quota that they're filling for the day, not an amount in a day, but at a certain specific rate, right? And again, that rate, it's always happening. It's never at zero unless you fully dried up, which again, if you're listening to this podcast, that's not the case. You can go back to my milk supply episode and hear about what drying up is actually requires, right? So all of that, even if your child's just getting a little bit, it's still really important. So your supply may temporarily increase. So if your child is breastfeeding more frequently for 3 or 5 days or so, then you might notice like a noticeable change in your milk supply. And again, your child's probably going to naturally taper off and you won't even notice. So the supply is going to kind of naturally increase with your child's demand and then naturally decrease as your child's demand decreases, right? And it will not be a big notice. But if you, for example, take 2 days off of work, your child's breastfeeding, or 2 or 3 days, and your child's breastfeeding very frequently, and then you go back to work, you may experience a little more fullness than you're used to. If you're experiencing it to a point where it's uncomfortable, then please, by all means, hand express for some comfort. You can just do not worry about collecting that milk unless you would like to. You absolutely can, but it's perfectly okay to hand express into a sink or even a toilet just to get some comfort for your breasts. And again, as that demand decreases, your supply will regulate again to what your child's demand is, right? So you don't have to worry about pumping or worry about like permanently increasing your supply. So what you can often worry about is, well, I've had this structure and this routine, and perhaps you even worked really hard to get that structure and that routine. And it can feel like we're going backwards, right? Like we're going backwards in the weaning process. But I want to reassure you, mama, that that is not true. Breastfeeding is meeting a need, right? You aren't going backwards because it's not a habit. Okay. If breastfeeding was a habit that needed to be broken, then yeah, you could say, oh no, we're kind of going backwards on our progress. But that's not true. It's not a habit. It's not an addiction. You are meeting your child's needs. So you can meet your child's needs with breastfeeding if you would like to, right? When your child is sick, there's needs that need to be met, right? They need that immune support. They need that comfort. They need all of those things. So you can meet them in other ways. And nature, biology, your own biology has given you this really beautiful, simple way to meet so many needs in one shot that requires not a ton of, physical effort or mental effort from you to give your child, right? So you can offer them breast milk and breastfeeding as a way to meet those needs. And it's okay if you want to meet those needs in other ways too. That is okay. So your child's needs have increased while they're sick. So that means that their desire and their frequency of asking to feed is probably also going to increase, right? And as their needs decrease, their frequency of asking and all of those things are going to decrease as well. So if that all sounds really scary to you, maybe your child's not actually sick right now, but you're listening and you're like, Jenna, there's no way that I can do that. I want to maybe kind of, that sounds like a good idea, but I'm so scared to offer my child more breast milk than we are right now because I'm scared that we're going to move backwards. If that's you, then first of all, please shoot me a DM. Let's chat. But that fear and that stress inside of you is important to listen to. And it's giving you clues to what's happening in your internal world. And it's giving you clues to what's happening in your relationship with your breastfeeding. And I already kind of plugged it once, but I talk about this in my workshop, how to tandem feed, toddler wean, and extended breastfeed without feeling like a human fidget toy or hurting your bond with your child or pushing your child away. And in that workshop, I really dig into listening to that discomfort and listening to that voice and why that's so important and how you can use that in order to create a breastfeeding relationship and a weaning relationship that sets you up for parenting success in the long term. So in the present and in the long term. So if that resonates with you, please go over and check that workshop out. I really encourage you to do so, or shoot me a DM on Instagram. I'd love to chat about it. Okay, so that wraps up my episode on breastfeeding your sick toddler. Yeah, I will catch you all next week.
If you loved this episode, make sure you hit that subscribe button so that you don't miss any episodes in the future. Also, check out my breastfeeding toddler communication guide and cheat sheet to learn how to say no to the feed while still saying yes to the need at www.ownyourparentingstory.com/guide. And that concludes another episode of Start to Stop Toddler Breastfeeding. The theme song is Little Balloon by Jenny and Tyler, and it has been a pleasure to share this time with you. I'll catch you in the next episode.